Now let's take it to the clinic. Let's get some real-life applications. First of all, we have to understand something. Friedrich A. Hayek once said we should not grow wiser until we realize that much of what we have done before was foolish. Similarly, you should not grow wiser in anatomy until you realize that your upper extremity is the mirror image or the exact opposite of your lower extremity. You don't believe me? Consider this. When you flex the elbow, your forearm is moving forwards and upwards. But when you flex the knee joint, your lower leg is moving backwards and upwards. They are the exact opposite. It's because, embryologically speaking, when you were a baby in your mama's womb, your upper extremity and lower extremity rotated in opposite directions. And that's why the cubital fossa is in front of your elbow, but your popliteal fossa is behind your knee. But if you follow the definition, which says that flexion is the decrease of the angle between the two parts of the body, it actually makes sense. What does not make sense is the part of the definition of flexion. Flexion is the approximation of two, morphologically, ventral surfaces. Well, that's a ventral surface and that's a ventral surface. So it makes sense here, but that's not a ventral surface. My lower extremity is the opposite of my upper extremity. Is this clinically relevant? Very relevant. Consider this. There is a disease known as eczema or atopic dermatitis. There is a skin rash or an eczematous rash that affects these persons, and it usually affects the flexor surfaces. And that's why you will see it in front of my elbow. But behind my knee, very important. Cause your upper extremities and your lower extremities are opposites. They rotated differently during embryological development. Do not expect to hear this from your woke anatomy professor anytime soon. Next, palpation of the radial pulse. Pulse, by the way, is not the same as heart rate. Pulse is an umbrella term that includes many different things to terms. One of them is the rate. Others include the rhythm, the volume, equality between the right and the left side as such. Here is the radius. That's a bone near it. There is an artery known as radial artery. That's right, radial artery. Ulnar artery, radial artery is more lateral. Ulnar artery is more medial. They came from a singular origin, known as brachial artery. So brachial artery was here. Then it divided into radial artery and ulnar artery. Very important. How do I palpate the radial pulse? With 3 fingers. That's the best way. Index finger, middle finger, and ring finger. And you put it on the radial artery, and you gently push the artery against bony prominence. Oh, that's how you feel the pulse. This is the end of our lecture. We hope you enjoy it.